Every year, 300,000 mothers and almost 3 million newborns die on what should be a joyful day, the day of birth. Taiba could have been one of them. Born in Bangladesh, Taiba was not breathing at birth. Thankfully, her birth attendant had been recently trained in the Helping Babies Breathe program and knew what to do. Building on the success of the Helping Babies Breathe Global Development Alliance, Survive and Thrive was formed by USAID with professional associations, private sector, and civil society. The goal of the alliance was to improve maternal, newborn, and child health outcomes through clinical training, systems strengthening, and policy advocacy. To do this, partners of the Survive and Thrive Alliance developed a transformative training methodology and worked together to bring this to scale, broadening the scope beyond birth asphyxia to tackle additional leading causes of maternal and newborn death.
It's not just a nice training package. We actually take it into the facilities where providers deliver women.
This particular training is so special because it's hands-on training, it's competency-based.
Voilà, ça permet vraiment aux praticiens, aux praticiennes de se sentir dans des situations réelles.
The Helping Babies Breathe program changed the global landscape for basic newborn resuscitation. Studies in Tanzania and Nepal showed a 47% reduction in neonatal mortality and a 24% reduction in fresh stillbirths.
I managed to deliver that woman. I resuscitated that baby for 30 minutes until the baby was okay.
The Alliance shows that quality improvement is essential to sustain quality care. A recent article in The Lancet suggests that more people die of lack of quality than lack of access. A major contribution of the Survive and Thrive partnership was the development of a practical tool to help health workers identify and solve their local problems in quality of care.
We are looking forward to better implement our program and to better support the governments in rolling out their national programs.
Today, the Helping Babies Survive and Helping Mothers Survive programs have been integrated into 30 national programs. Partners have identified best practices for program implementation.
I realized many things regarding preparation of the intervention, on how to implement those tools, how to sustain the tools, how to measure the success of how we implement.
The Alliance also demonstrated that strong professional associations are a pathway to sustainability. The Survive and Thrive partners increased global access to life-saving solutions and mobilized $120 million in contributions. The lessons learned from the Survive and Thrive Alliance should be considered stepping stones for future initiatives.
Well, we never can achieve our goals as a single individual or single organization.
I think the potential for the Helping Mothers Survive and Helping Babies Survive materials is enormous. I think we get an enormous amount of support when we think collaboratively and when we work together.
Around the world, more than 500,000 birth attendants have been trained and equipped to save lives. Lives like Taiba's. Today, Taiba is a healthy and thriving 6-year-old.